So I'm going to get started. Oh, and some credit before I move into introducing our presenters. Our educational seminar talk series is supported by generous funding from the National Child Traumatic Stress Network and SAMHSA. So we are very grateful to those national providers who have given us some funds so that we can help to educate our community about different topics in the world of children's mental health. And without further ado, I'm going to introduce you to your presenters for today. Our presenters are Taylor Goodman-Leong, who is a social work fellow at the Center for Effective Therapy. She is based out of our Boston Center. She's a graduate of Boston College School of Social Work with a master's in social work with a clinical focus in children, youth, and families. She has a previous mental health service history in therapeutic mentor and social work intern roles and has just wrapped up her first year as a fellow in our program. We have a 2-year fellowship program that is an in-depth introduction to the children's mental health world, and we're very lucky to have Taylor as part of our group for our fellowship program. And our second presenter for today is Liz Garant. She is a licensed mental health counselor and a staff mental health counselor at the Center for Effective Therapy in our Waltham location. She graduated with her master's in clinical mental health from Boston College and has worked in a variety of mental health settings before coming to grace us at the Baker Center. And again, we're so lucky to have her. She specializes in working with youth with anxiety, trauma, depression, ADHD, and behavioral challenges, and is certified in 2 evidence-based practices: the modular approach to therapy for children with anxiety, depression, trauma, or conduct problems, and parent-child interaction therapy, and has additional training in other evidence-based practices as well. And both Taylor and Liz are extensively trained in the assessments that we conduct here at the Baker Center. And we'll be telling you about those assessments as well as other assessments in the world of children's mental health.
Thank you, Sarah. So as Sarah said, the scope of this educational seminar is really to discuss different types of evidence-based youth mental health assessments. Our hope is that you can leave with kind of a base understanding of what type of assessment might be right for your child and really understand the benefits of receiving quality assessment and how it can inform treatment, and also give you a general sense of how to get started, regardless of what type of assessment you're seeking. And we'll give you kind of a specific look of the assessment process here at the Center for Effective Therapy. So, what is an assessment and why should you get one? Mental health assessments come in a variety of shapes and sizes. We're really going to specifically talk about assessments that are kind of structured, evidence-based assessments, and specifically how these translate to your child's care and the practical benefits of receiving them. So there are kind of 4 clusters of benefits here. The first one is diagnostic clarity. So it really better helps understand challenges and strengths and can allow families and kids to receive accurate diagnoses and psychoeducation. So really understanding, what does that mean? What does that look like kind of longer term? It also can instill hope for families because they understand what the presenting concerns are and also what can help and what are the next steps. They also inform treatment. So they translate what we know about a child's challenges and the level of support that are going to be helpful to other relevant settings. So for example, school consultation with counselors, psychoeducation for educators, and giving educators or other folks who interface with your kiddo some information to kind of shift their understanding. And that was actually coordination of care. Informing treatment, really it informs treatment planning and determines what course of treatment is going to be the most effective. And it gives a baseline of symptom severity, need for treatment, really what is the appropriate level of care for your child. And then lastly, children's mental health is complex. There's so many different things that kind of inform treatment, that inform presentation, that inform diagnoses. And so this kind of assessment, this really in-depth evidence-based assessment that we'll be talking about, considers contextual factors, considers etiology. It can really understand what's driving the bus for your child and what are things that are kind of passengers in the bus. So, where should we get started for treatment? Often we can target the primary challenge and actually alleviate other symptoms, or can clarify if additional testing or treatment is needed based on an assessment. Taylor later will share a really fantastic practical application of assessment in this seminar, which is going to highlight that a lot of symptoms or behaviors for kiddos can overlap. And understanding that kind of primary, again, what's driving the bus can help cut down on overdiagnosing or inaccurate diagnosing, and can really target treatment in the most helpful way. So there are more than 3 types of assessments in the world, but we're really going to focus on sort of the primary evidence-based types of assessments. Again, for kids, there are different kinds for adults. So we're going to kind of break these down and help you identify this type of assessment, again, that is the best fit for your child. So for today's purposes, we're really going to be focusing on neuropsychological assessments, or neuropsychs, so that I don't have to say neuropsychological assessments multiple times, diagnostic assessments, and then more specific evaluations and tests, such as measures looking for autism spectrum disorder. So each of these types of assessments certainly have benefits. They're really useful in their own ways, but it can feel fairly overwhelming to determine what is the right fit, and where to get started. So hopefully we can help give you a little guidance on that. So neuropsychological assessments, the primary goal of a neuropsych is to really understand the relationship between behavior and cognition. So most folks are probably familiar with this type of assessment, particularly if you work in a school. In the context of understanding learning challenges and their applications to school or academic settings, and in relation to diagnosing specific concerns that really require a robust assessment of multiple domains related to learning, comprehension, cognition, processing speed, memory, fine motor skills. They really dig into and understand kids' learning profiles. So you can see there are multiple different presenting concerns, which might lead someone to seek a neuropsych assessment or be recommended to seek a neuropsych assessment. So a quality neuropsych assessment is going to begin with kind of a specific referral question. And then the neuropsychologist who is conducting the assessment is going to work to identify specific measures, specific questionnaires, specific tests to really help answer those questions. So it's fairly targeted in that way. The questions can be fairly broad, but they're also determined by kind of an individual's need. So for example, a neuropsych can assess questions of, learning and comprehension, reading abilities, learning disabilities, and can provide those really specific diagnoses. They can also diagnose things like ADHD, different mood disorders, will sometimes include things like anxiety diagnoses. Those can also be clarified through a diagnostic assessment, which I'll talk about next. So a neuropsych assessment is always completed by a neuropsychologist, and they're really evidence-based for kids ages 6 all the way up until adulthood, although many evaluations occur at a younger age, depending on need and sort of presenting concerns. So in the previous slide, I referenced specific evaluations for things like autism spectrum. Those can be often done for kids who are younger. They can be done as part of a neuropsych assessment or as kind of a standalone measure. So next we'll talk about diagnostic assessments. So if your child is struggling and you're really not sure where to start, a diagnostic assessment is probably a good spot to start with. It's also a really fantastic assessment for kids who have maybe been with multiple treatment providers and received various recommendations or various treatment approaches, or if treatment hasn't been successful. Oftentimes, kids who come to the Center for Effective Therapy for assessments have sort of been in therapy for a really long time. They've worked on different things using different ways or approaches. So this can be really helpful. in that kind of diagnostic and then also treatment clarity. This kind of assessment can also support referrals, and it can also flag for additional areas for evaluation and monitoring, such as attention concentration, motor skills. These assessments will include recommendations for if a child needs maybe an occupational therapy evaluation based on what's coming up in this assessment, if they need a neuropsych for things that are coming up that can't be answered through a diagnostic assessment. They can also suggest things like school evaluations, school testing, kind of a pretty broad range of things. They also, again, take into consideration those contextual and like etiology of children's mental health. So, things like cultural background, familial needs or stressors, caregivers, sort of view and perception of mental health. So it is pretty broad speaking. So these assessments include standard questionnaires based on the child's age, which may include measures that aren't actually specific to what your child came in for. But that broad assessment is really useful to ensure that all things are being assessed. Again, children's mental health, things look very different ways. A lot of behavioral presentations can kind of overlap with other things. So this is a great way to find out areas of need that maybe weren't being thought of or captured. It also includes interviews and can include questionnaires for kids' teachers, their coaches, can also include like consultation with teachers, doctors, current therapists. Taylor's going to dive into this process a lot more from start to finish, but this is just sort of as a general overview. So bottom line, a good diagnostic assessment is a fantastic way to start and should include kind of core components. So interview, questionnaires, feedback session. And as I said, Taylor will really dive into that. You can see here there's a couple different empirically validated examples that have a lot of different words attached to them. We will talk specifically about the CASADS, or the Kitty Schedule for Affective Disorders and Schizophrenia, which is what we use here at the Baker Center. It's kind of that gold standard for youth mental health assessment. So I included this because it's a lot of information, and there are some overlaps, right? So in the middle, you can see they're all using standard measures. They're all being completed by folks who have training in mental health, who have specific training on the measures that they're using. They're including a report, they're including a feedback session, and they're including actual concrete recommendations. So after you receive a diagnostic report, it has sort of a journey beyond that. It keeps going. It doesn't end with, here's a report, best of luck. And that's common across all assessments. And again, facilitation of coordination and care. So diagnostic assessments, as I kind of said, they're a great starting point. They're more broad versus a neuropsych. If you have really specific questions about cognition and things like that, that's going to make the most sense for you. Whereas a diagnostic assessment can lead to more target evaluations if they're needed, but oftentimes diagnostic questions and treatment can be determined through a really quality evidence-based diagnostic assessment like the CASADS. They also have significantly shorter wait lists, which means kids are often able to understand what's going on for them, get into treatment with that goal of sort of getting better sooner. They're also more cost effective. And if there aren't, again, those really specific questions about learning and cognition, a neuropsych actually might not be the most appropriate type of evaluation. I'm going to turn it over to Taylor now, who will talk a little more about a case example.
Okay. Thanks, Liz. So before we jump into our case example, I want to do a quick transition to think about, now that we've looked at a few different types of assessments, when should you look into an assessment for your own child? So one question that might be helpful to think about is your child's behavior impacting how they go about their daily activities? So whether it might be emotional or behavioral challenges, is it preventing them from doing what they need to do? Or is it making maybe daily routines a little bit more challenging? Another question that we like to think about is your child's behavior impacting family functioning? So not only is your child's behavior maybe a little bit difficult and becoming difficult for them to do their own transitions and those types of things, but is it extending throughout the family? So does it feel like you're managing your child's behavior, and is taking up more time that impacts everybody else in the home. Another question here that we have is your child or teen struggling, but you're not quite sure why? This can always be a great reason to seek an assessment where, with what Liz had just described in, previous assessments, that we can always dive deeper and look at what might be some things that are going on for your child. And another one that can be common is that thinking about the question of, let's say your child's in treatment currently at the moment, whether it's a talk therapist or some other type of service, and it might feel like that maybe not as much progress is being made at, compared to the beginning or things like that. So this can always be a helpful check-in point to think about, okay, maybe we can do an assessment to look and evaluate, is this maybe the most effective treatment for my child at this point? And maybe are there other things that could be going on, and using an assessment would be really helpful to figure out what's happening there. Okay, so looking at a case example. So let's say here that we have Noah, and Noah is a 7-year-old boy living in Boston. So just very briefly at the start, and we'll go into more details as we go along throughout the whole process. But just as the start, the caregivers are reporting that Noah has daily tantrums. He has a really hard time following instructions, and he also has a tough time with transition. So whether that's getting ready to leave the house, or maybe leaving a place that is really fun and he has a hard time going back home, like maybe he's at the park or maybe he's with a friend, and it's hard to make that has a hard time separating from the parents. So whether that might be bedtime routines or school drop off and things like that. So I'm gonna go through an example with Noah, just thinking about what is the evaluation process. Also, I just got a notification saying my connection's unstable. So Liz or or Sarah, if you want to interrupt me and need to rewind, then I can do that. But okay, so here we're at the diagnostic evaluation process. So assessments and begin treatment. But I would say that if you're looking for a really thorough assessment, no matter where you go, these are some pieces that are really important to be on the lookout for. I would say in particular, a phone screen is always helpful at the start. I'll go into the details again through our case example with Noah, but a phone screen can gather a lot of just general information as to why are you seeking services at this time, what are the big kind of challenges or behaviors that your child is experiencing at that moment, and then we can evaluate whether or not you would be a good fit for our assessment process. So I'll speak to the assessment process in detail, but with the feedback session or the feedback appointment, Liz had mentioned this before, but saying that with our center and many others, it's really important to not just have that assessment completed and say to families, oh, off you go, good luck seeking services. We really want to make sure that we can connect families with appropriate treatment and potentially refer them to other services if it feels like they may not be a good fit for us at the time. So that feedback session is really important, wanting to continuously collaborate with the families that we work with. And then this last flag here, thinking about what does treatment look like in ongoing assessment, I would say one piece just to think about is that when we think about the context of assessments right now, we're thinking initially about, what is that big almost evaluation at the start. But I would say that assessment is something that happens continuously throughout treatment as well. So we may not do as extensive, doing interviews and things like that as we do treatment, but it's always something that we're on the lookout for and can continue to help determine what kind of treatment is most helpful at that time. Okay, so looking at the phone screen. So this is the first step if you would be interested in looking into an assessment. So I'd say here at our center, the model that we use is that it's usually a 30-minute phone call that you can register and sign up for a phone screen slot on our website. It is a free phone call, and essentially what this does is that it is really helpful to gather some key information points. So for example, we'll might screen for a variety of different behaviors, whether it's disruptive behavior, maybe anxious or low mood type behaviors, as well as any traumatic experiences or exposures. And so generally we'll ask, what do these behaviors look like? When do they pop up the most? Almost to gather essentially like a snapshot in time for your child. And we'll also ask, what are your main concerns and what are your hopes in terms of getting an assessment? Another thing that we'll ask about is any relevant history, and this history can also include any previous testing. So whether you're testing, sometimes we have families call and they say, yep, like my child has a 504 plan or they have an IEP. Anything like that and any supporting documents is really helpful to know and keep note of because that can help inform our assessment process as we go. Another piece that I wanted to talk about with our phone screen is that we do want to be really transparent. So part of the phone screen will be discussing the cost of treatment, talking about insurance, seeing if you're in network with us or not. And if not, we can talk about our sliding scale rates and what that looks like there. But I always want to throw that out in the sense of, to be prepared. So when you're calling, you're not just asking, about what are the behaviors of my child at this point in time, but what does the logistical pieces look like here? So what does that assessment actually look like? How much is the assessment and what would treatment be? And so ultimately, when we have this phone screen, our screeners are looking to see if you would be a good fit for not just essentially our assessment process, but potential treatment. So for example, some reason we may not say, or we may say that you may not be a fit for our assessment process would be, let's say your child might need or may be recommended for a higher level of care. So at our center, for example, we run with a weekly therapeutic model. So we see clients usually every week. But if there's something that feels like they might need a higher level of care or more services included, we'll talk about that and we can refer for other services like that on the phone. Another piece that we may talk about in terms of being a good fit or not is thinking about what kind of assessment are you looking for? So sometimes we might have families call and say, yep, we're also, not just looking at a potential diagnostic report, but we'd also like to see if maybe there's an evaluation for any learning disabilities or learning challenges, or maybe they're looking into more autism spectrum testing. And so as Liz had mentioned, this is almost that third category. And unfortunately, at our center right now, this is something that we don't specialize in, but we're, again, more than happy to refer out and share some other resources and services that can do this testing. So coming back to our NOAA case example, let's say that the caregivers call. I know that they had talked about just general daily tantrums. Maybe our phone screener might say, maybe there's some kicking or yelling involved. Maybe, is throwing objects. Maybe also he has a hard time listening. So he won't listen when parents ask him to do things, especially getting off of screens or anything with screen time. And then similarly, thinking about hard times with transitions and separating from parents, they specified that school drop-off is particularly challenging where Noah might cling to parents before he leaves and goes into the school building, and a teacher might have to help with that transition. And then at nighttime, they might say that they need to sleep with Noah until he falls asleep. Otherwise, Noah won't leave the parents. Okay. So as we get into step 2 here, so thinking about the assessment process. So our assessment process typically is split up into two different portions. The first one, we save space for caregivers. And so usually this takes about an hour and a half for an appointment. And so this consists of a semi-structured interview as well as questionnaires that we'll hand out to the families and they can answer those when they come in. And so generally, also just to think about assessments broadly, we say that we also provide essentially a psychosocial assessment throughout our diagnostic assessment process. So in addition to asking questions about low mood and anxiety, disruptive behavior, all those types of diagnostic pieces, we also ask things about, what does general questions almost about what does your child's family and kind of social environment look like? What is school like for them? Are there any important cultural or family values that you hold and things that you feel like are really important to discuss there? Also just asking about, what are your overall reasons in terms of why you're seeking services at that time? And so the big part of the semi-structured interview, like Ms. Liz had mentioned, is talking about the case ads as our model that we use. So we'll talk about questions that might have to do with, does your child have low mood? So does it feel like, they feel sad, down, or blue for most of the day or maybe most of the week? And so some of these questions may not be relevant to your child, which is completely fine, but everyone goes through the same assessment for people that we start doing assessments with. So that's okay if some things may not be relevant. Maybe For Noah, for example, the disruptive behavior, maybe some of the anxiety about separating with parents might be more pressing here. And so what will happen is we'll ask all of our general questions. We might ask some more in-depth questions later, potentially to learn more about that disruptive behavior specifically or that anxiety. Um, so let's say, just thinking about Noah, we can pretend that maybe the clinician might ask, okay, when do the daily tantrums happen? How frequent are they? How often are they happening? So we'll gather lots more information there to gather not just data on what does that look like, but it can be really telling to help with diagnosing potentially what might be going on. So similarly, in terms of separating with parents at night or separating from school, we might say a question or pose a question in terms of the nighttime piece. So let's say, parents say that Noah can't separate without parents until he falls asleep. And so we might ask, if you were to try and separate and let him go to sleep on his own, do you think he would be able to do it? Or do you think that it truly takes a caregiver being right next to him? And so, again, those are some examples of some in-depth questions we'll use. Okay, so thinking about the child portion of the assessment, I will say for our center for children that are usually 7 and up, we do the same exact case ads procedure and semi-structured interview that we use with parents. We've reserved about an hour and a half length of time. For some kids, we may not use all of that time, which is totally appropriate, makes a lot of sense. I will say we have a younger child assessment that varies a little bit. I won't go into that too much today, but for kids usually that are under 7 years old, that looks a little bit different, and we'll do a lot more behavioral observation pieces. But thinking about Noah, who is 7 here. So we'll ask lots of general questions at the start, asking about school, family, friends, what do they like and not like about certain things, what are things that they like to do. And then we'll jump into the case sets questions, which is the same set of questions that we ask parents. Kids will also have their own separate questionnaires that they can fill out on their own for some self-reporting questionnaires there. And one piece that we also note for the child portion of this assessment is we do a lot of behavioral observations. And so you'll see this in our diagnostic report, which I'll talk about a little later. But let's say, for example, knowing that Noah has a hard time separating. If I were the clinician, I might see in the waiting room, okay, is he able to separate from mom and dad? Or does it maybe take mom and dad and Noah to all come to my office, maybe look in, see where he's going to be, and is he able to separate after? So all of this is really important information that contributes to the assessment. And so as we see here, just writing up, let's say I meet with Noah and he says, nope, I don't ever have any tantrums. Like I'm totally fine at home. Things are great. Maybe some of the more notable things he might say is, I don't like school, when talking about maybe having to leave to go to school and those types of things. And he also might say, I don't like when my parents tell me what I have to do. So again, this is a really good example of not only how common it is for kids to provide responses like this, but again, it can be really helpful to see, how much insight they have into some of the challenges that might be happening at home. Okay, so as we get to our third step here, so looking at the feedback session. So I'm going to talk about the pieces on the left here first. This is thinking about what is that diagnostic report and this logistical piece here. So typically, just to give a little bit of a timeline, the assessment itself usually will take place over 2 weeks because we do 1 week for the caregiver, maybe the following week the child will come in, and then usually it's about a 2-week wait between that last assessment date and then your feedback session. And so this is helpful because it allows the clinician to write the diagnostic report, evaluate, and kind of look at what are the results of the assessment, whether it's the interview, the questionnaire, the behavioral observations, all of those pieces. And all of this gets written up into a diagnostic report. And so during this feedback session, what will happen is essentially we'll kind of share a screen, say, here, this is our report. Have you ever seen something like this before? And we'll walk through it piece by piece. And I think this is really important too, because, we're reviewing this with families. We're not just saying, here's this final report. Good luck. See you later. So we go through it step by step with the family. And not only do we review the interview results and the questionnaires, but we really will talk a lot about any potential diagnoses that the child meets, as well as discussion of treatment and next steps. So on the right here, thinking back to our Noah example, let's say the clinician meets with him and he meets criteria for separation anxiety. And I'll talk about this a little in the next slide, but just for the case here, we'll say he has separation anxiety. And so the treatment recommendations are first a course of behavioral parent training. And this is essentially parent sessions that we offer here at our center that do not include the child. This is mainly helpful to provide, how to manage behavior, whether it's, disruptive, struggling with inattention, those types of things. And we found that it's really helpful to work with parents directly. And so we might say, this is the first recommended course of treatment. And then we say afterwards, if it still feels like the separation anxiety is still present and something that is of concern to parents and is impacting, Noah's ability to be able to go to school or to be able to fall asleep on his own, we might recommend a course of cognitive behavioral therapy. So this would be individual work with Noah, but given Noah's age and he's only 7, it would have a heavy parent component as well. And so here, our model for anxiety work, just to give a brief snippet, is doing lots of potential, exposure and practice. So maybe, with the sleep piece, it might practice from, maybe Noah and the parent doesn't have to be maybe right in the same bed for them to fall asleep, but maybe the parent might be able to sleep on the floor and maybe eventually just stand in the hallway while the child falls asleep. And so little things like that we'll go through. And then eventually, we'll talk about coping skills, how to practice this anxiety piece, and all of those types of things. Another piece that we may recommend is school collaboration. So for Noah, knowing that the school separation piece is something that's challenging. Sometimes we recommend working with the school. So whether it's talking with his teacher or maybe school counselor, if he has a counselor at school, we can talk about collaborating there to make that school transition a little bit easier. Okay, so and our last step here, thinking about treatment and outcomes. So just as a broad piece, I know I talked about it a little bit in the last slide, but thinking about what does treatment look like overall and how does doing a really thorough assessment impact both the treatment and diagnoses and outcomes for Noah. So I would say the assessment can be really helpful because not only are we looking at the individual child, but we're looking at how the caregivers are interacting in this space. We want to have lots of school collaboration. So not only is it just a potential clinician working with this family, but really tying in the community. So if it feels like it's relevant. So, not only with school pieces, but I have other here, for example, let's say Noah has a nanny that they work very closely with, and the nanny's there 7 days a week. Maybe there are a lot of nights as well. And so if it's important for another member of their community to take part in this treatment, that's something that we always recommend and want to include. And then thinking about the differential diagnosis. So I know that before we had diagnosed Noah with separation anxiety, and this is a really good example of how, from the first step of looking at the phone screen to where we are now in terms of the feedback session and looking at what the diagnosis is. Originally, it seems like, Noah has a lot of disruptive behavior, right? So whether it's the tantrums, different outbursts like that, hard time following instructions, all of those types of pieces, as you can see here in this little picture, a lot of these symptoms can overlap. And so in Noah's case, we felt like that the separation anxiety was a better explanation and could almost encapture a lot of the other disruptive behavior. So let's say, we learn a little bit more throughout the interview and the assessment, and it appears that a lot of the tantrums and the outbursts are tied to when parents maybe have to leave the house. And so for that example, it would indicate maybe that it was more of a separation anxiety situation, kind of like core in terms of where is this behavior coming from, rather than just the purely disruptive type behavior. I would say ADHD also has a big encompassing circle too that we'll evaluate for to see, is my child inattentive or has a hard time focusing? Maybe are they, very active in doing all of those pieces. But again, in this example here, it felt like that separation anxiety was the forefront of a lot of the, outcomes and the results of a lot of Noah's behavior. So essentially through this really thorough assessment, not only is, Noah having that diagnosis of separation anxiety, but now he's primarily viewed as an anxious kid and not necessarily just a purely disruptive kid. Maybe he doesn't like school, all of those things. But this also opens the door up to have lots of consultations, potentially meeting with a school to maybe get a 504 plan in place to help that transition to school.
Okay. So I'm going to talk a little bit about how to introduce assessments to your child. So for a young child, and we think of this as probably 7 or younger, although you know your child the best. an easy way to explain this appointment is by talking in terms of previous experience, like going to a doctor's appointment. So most kids are used to meeting with their pediatrician, and they understand that going to a doctor is something everyone does just to make sure that they're healthy. So using the phrase feelings doctor can be a great way to introduce the idea of an assessment and meeting with a clinician to younger kids, because it really builds on that common understanding. Yep, I'm going to go to a doctor, talk about ways to feel better, just like if I have a sore throat. Language that we use in assessments is also really intentional here at the center. And again, that should be a common kind of piece for quality assessment, is really intentional language to sort of help normalize mental health and explain to kids that some kids come to feelings doctors because they worry or they feel sad. Other times kids are coming because they have a hard time making friends or paying attention, or sometimes kids come because something scary has happened to them. So really making it clear there are lots of reasons that kids come to feelings doctors, and we're here to learn more about you and see how we might be helpful. As parents, some other pieces that you can use, again, focusing on positive language. You get to learn new tools, you get to talk to someone about how you're feeling, and then also things that can be helpful to reinforce kids' engagement and sort of coming to this appointment, which oftentimes can feel hard for kids, especially if you're bringing in an anxious kiddo. Our use of labeled praise, which can just really reinforce and strengthen great behavior for kids. So I have some examples there. If you're a parent, you are likely already praising your child. And so just building on what you're already doing to help your child approach things. Sometimes also a reward is helpful. So for example, once you do this appointment, you can have a sticker, or we'll read a little extra at night for story time. We also use reinforcements such as rewards, stickers, prize bins. So those things are really helpful for younger kids. For adolescents or teens, we're going to talk about it a little bit different. So teens and adolescents often have mixed motivation to receive help or try therapy. They may be coming into an assessment with kind of mixed experience based on their familiarity with mental health care. So for example, how it's talked about amongst their family, their friends, their communities, the type of media they're exposed to, and also the nature of their presenting challenges. So for example, a teen who's coming in and is quite depressed, or maybe has been in therapy for a while without seeing any impact, may feel like it's just kind of useless to come in because nothing will change. Some kids may have pretty significant stigma still around mental health and what therapy or assessment says about you. So that first part is really normalizing. Lots of kids do this. You can reflect their concerns or validate, this might feel really hard. You can also sort of determine if using a healthy amount of self-disclosure might be helpful. So for example, if I was a really anxious kid and I went to therapy and I received help, you might share that with your teen, just to sort of normalize the challenges and show that things can change. The next one is, confidentiality. So being able to sort of ease worries about sharing sensitive information. This clinician's a safe person for you to talk with. Your boundaries are going to be respected. And information will only be shared if there's a safety concern. That's also language that's echoed with your teen once they come into an assessment. So it's sort of made very clear throughout the process. Choosing the right moment as well can be kind of helpful. So trying to avoid really high tension moments, like when you're lower resourced. So for example, at night or right as your kid's going out to like soccer practice or something like that, and aiming for kind of a positive or even neutral moment. The next one is encouraging your teen to think about their personal goals. So as Taylor explained, part of the case ads is obtaining caregiver and child top problems. And that can really help buy-in for treatment and assessment, because it's collaborative versus, this is something done to you. This is what you're going to work on. It doesn't matter what you think. So that buy-in and collaboration are really, really helpful for adolescents and teens. Ongoing conversation is also a big part. So being able to leave the door open for ongoing communication, answer questions honestly, and kind of encourage teens to think of questions they may have about treatment or diagnosis. Sometimes they can have their own feedback session if they're an older teen, and that can be really helpful. Chance for expectancy and just explanation of kind of what treatment will look like, what questions your teen has. And then finally, some teens get kind of automatically defensive with this topic, which is totally normal. It can be a hard topic to talk about. It can be hard to admit that they're struggling, and they may feel embarrassed about coming in to meet with someone. Just showing them that you are kind of calm and even and reliable can go a really long way. And then the last slide that we have is just sort of a list of frequently asked questions that we get as folks doing clinical assessments, evidence-based assessments. I don't see any questions in the chat yet, I don't think. So I will go over this, but if folks have questions, please put them in the chat. We'd be happy to answer those as well. So oftentimes parents come in like, can't I get mental health treatment without an assessment? I've done this in the past. Yes, you can. Many organizations and providers don't conduct a structured diagnostic assessment using evidence-based questionnaires and practices prior to beginning treatment and forming that treatment plan. We strongly believe that a quality, thorough assessment is a cornerstone to quality care, particularly evidence-based care, with that goal of understanding presenting concerns and utilizing treatment that is really going to be the most effective in helping kids get better quicker and stay that way longer. The second, what if my child already has a therapist they really love? Great. If they have a therapist they really love working with, that relationship is so important. They can continue to work with that provider. We can engage in some care coordination. And I'm saying we, again, any center, any provider should be able to do this work. And we have other educational seminar series available on our website that talk about specific presentations for specific diagnoses and what to look for quality evidence-based care and what to look for in a provider who offers those cares. So, certainly you can continue working with that therapist. For folks who live out of state, oftentimes we have folks come to CET and they receive an assessment and then sort of use that as a blueprint for other providers. Assessments are using kind of a common language, particularly for what evidence-based practice is indicated and is going to be the most effective. So you can take that report, you can take it back to your own state, for example, New Hampshire, and find a provider there who can offer those treatments. If you want to work with the Center for Effective Therapy, but we don't take your insurance, treatment has to be feasible for your family financially. That's, a huge part of access for treatment. So we offer here at the center a few folks or a few kind of options for out-of-network folks. We have self-pay, we have sliding scale. So that's something, don't let that deter you from reaching out. Even for the assessments, we have those options based on financial need. The last piece is, I really want my child's school, for example, to understand them better and give them the support they need, but I don't necessarily want to share my full diagnostic report. We can suggest school consultation, and that's often a recommendation that we put in diagnostic reports and as part of diagnostic assessments. There are also options for like diagnostic letters, summary letters. So really getting across the key points of like, this is how, for example, anxiety shows up for this kiddo. It actually comes across as what could be defiance. So really helping the school understand. And lastly, what if things change? Things should change. Assessments are kind of a snapshot in time. They're not meant to be concrete for years and years and years. And that's where ongoing assessment can be so important.
Thank you so much, Liz and Taylor, for that comprehensive overview of different assessments and what we do at the Baker Center. We do have a question in the chat about whether it would be appropriate for school supports, such as a school psychologist or a school social worker, to use an assessment like the case ads. Could you speak a little bit to the training process for the case ads, making sure that if you are using validated and evidence-based measures, that you are trained in how to use those to fidelity, that kind of thing.
Yeah, I can speak to just, getting trained in case ads. And then Liz, if there's anything else you want to add, you can feel free to jump in after. But I would say, for our center, we did go through some extensive training for how to use the case ads. So not only was that, an introductory, looking at all of the different sections, those types of things, but we shadowed multiple clinicians to say, okay, here's how, the using the case ads looks like in real time. But then also we were doing co-led case ads assessments with other clinicians on the team before we became almost like case ads certified. But I'm not sure, Liz, if you have more of a in-depth answer, even Sarah, in terms of what that could look like in terms of translating that to a school, actually.
Mhm. Yeah, I mean, my understanding is so the case ads, as long as you are, a licensed certified kind of mental health professional and you have access to that training and kind of the initial supervision, you can use it in, as a school social worker, things like that. I will also just plug here, this is the website for the case ads, which I can put in the chat, which likely has kind of more information there. And they also have sort of a contact us if you're curious in using it at your organization or as a provider, and they can answer some of those questions as well.
If anyone has additional questions, please feel free to drop them in the chat. You can also come off mute now if you have a question and you are willing to have your voice recorded for posterity as part of our resources that we are accumulating at the Baker Center as we're um, saving all of our recordings of these educational seminar talks. You can also message me directly through the Zoom chat if you would like to share a question, but don't want it attached to your name and would like it to be shared anonymously. All right, looks like it was such a thorough and comprehensive presentation that there are not very many questions about our assessments overview, the different kinds of assessments, what you might expect. So thank you so much, Liz and Taylor, for hosting and for sharing your expert knowledge with us. I'm gonna click through a little bit. I'm going to click through so that if you have additional questions, following hanging up with us, or if you have questions that are coming up that are very specific to your child or for providers to a child that you are working with, you can reach out to us at the Center for Effective Therapy to get some more tailored feedback about what assessments might be appropriate for a specific kid, and that sort of thing. You can reach out to us either via phone, via email, or our website, bakercenter.org, and you can get started to schedule your initial phone screen with our intake staff if you are interested in connecting with us for services. Please keep an eye out for us for more events and resources. We're continuing our seminar series with an event on the last Thursday of every month. You can also reach out to us or connect with us on social media for registration information so that you are aware as we've got more seminar series and other related resources, blog posts, and things like that coming out. You can connect with us at BAKERCNTR on Instagram, YouTube, and X or Twitter. And thanks everybody so much for joining us this morning. So lovely to have you all. And yeah, thank you. Thanks for being here.